Are you planning to fall pregnant? Then that is something you should start discussing before you actually fall pregnant. Definitely visit your health professional and get the advice that's most appropriate for you. I'm Dr. Kavipriya Soma. If you'd like a consultation with myself, please visit the website www.athenawomensclinic.com.au to book in an appointment. Otherwise, see your own healthcare professional. So what do we do in preconception consult? The first things would be to get a history from you. So we want to make sure that your medical history is all good. So there is no high blood pressure or diabetes or thyroid issues, asthma or epilepsy. So basic stuff that we want to know about you so we can advise or tailor-make the advice for you accordingly. Second question that we would be asking is if you've had any previous surgeries, or is this your first pregnancy or second or third, whichever number of pregnancy it is, because your medical, surgical and what we call previous obstetric history will impact the future care of this particular pregnancy. Apart from this, we also ask for your diet or nutrition per se, your exercise capabilities, and of course smoking, drug, alcohol. All those questions will be thrown at you. Now, as a part of this consultation towards the end, there will also be some blood tests that may be organized to check your status in health. So first things first, let's talk about nutrition. So it's a broad topic and I am not an expert in nutrition. I can give you some basic principles that I'd like you to follow. But if you have any specific medical conditions, then please consult either your health professional or seek expert advice from a nutritionist or a dietitian. The simple principles I would encourage you to follow is eating whole meal foods, sticking to vegetables, fruits, and if you are a meat eater, then have the meat either grilled or steamed. So this would be the basic principles. Now, a controversial topic here, as you all know, the food is not as nutritious as it used to be 20-30 years ago. So that's a topic of debate, totally separate from what we're dealing with. So in view of that, we have to take certain supplements so we can have better outcomes for your child. So the first things that I would encourage you to do is start taking folic acid supplements. So for a woman who has no previous history, or if this is your first pregnancy, the general recommendation by the Australian College of General Practitioners and the Australian College of Obstetrics and Gynecology is to administer 400 to 500 micrograms of folic acid per day. This is available as a part of most prenatal supplements that's available in the market. I would leave it with you to do your research to see what suits you the best. But the recommended daily allowance of folic acid would be to 400 to 500 micrograms per day. If there is an underlying medical history, then this recommendation may change. So please consult your healthcare professional to adjust that daily recommendation that is required for yourself. Now, the second supplement that we generally encourage you to take is iron and calcium, again based on your levels of iron and calcium, which would generally get tested. The recommendation would be provided by your healthcare professionals, but also make sure your diet is adequate in iron and calcium. Now, again, like I said, please seek help from your own nutritionist or dietitian, but these are the general principles that I would get you to follow during the preconception period. Now, combined with this, definitely no coffee. I know not many will be happy with that, but limit your coffee intake or caffeine intake per se to as much as possible. It may be difficult in the initial phases. You can replace it with its caffeine-free alternatives because hydration is important as well, but limit or bring it down to zero as much as possible. And that's why you would want to have the preconception consult before you fall pregnant, because you want to make these lifestyle changes when you're actually in the early pregnancy pregnancy, because the early pregnancy is the time when organ formation happens. So by the time you realize you're pregnant, the organs are almost there. So you really want to have a good, good soil. So the base has to be really prepared before you fall pregnant. Just wanted to alert you to the fact that we are going to release a series of preconception videos. So the first one would be the nutrition, followed by exercise. Then we have the drug and alcohol, mental health, as well as the genetic carrier testing and investigations and advice. So if you'd like to listen to this, please don't forget to subscribe to our channel. So continuing with the nutrition advice, some of the other things that you should be aware and you should be taking as well is iodine. This is the recommendation by the Australian College of General Practitioners, 150 micrograms per day of iodine, which is generally available or incorporated into the prenatal supplements that you take. So just make sure you read the ingredient list and make sure that the RDA, or the recommended daily allowance, is appropriate. The other supplement that I'd encourage you to take is vitamin D. But generally, your health practitioner should be checking for vitamin iron and vitamin D and vitamin B12 levels as well. If you're a vegetarian or vegan, sometimes you can have issues with vitamin B12 absorption or low supply. So again, after checking if the supplementation is needed, please go ahead and speak to your own healthcare practitioner and take the appropriate required daily allowance as well. So that sort of completes the advice on nutrition. This is just a general overview. Again, if you've got specific medical conditions or issues with your gut or absorption, please speak to your own healthcare professional or a nutritionist or a dietitian. Or if you'd like more advice, then you can visit our website, www.athenawomensclinic.com.au, to book an appointment, and I'm happy to walk you through. Thank you.